There are many different reasons for needing a feeding tube, but the common goal is to obtain nutrition. There are two basic types of feeding tubes. One feeding tube goes into the stomach. This is called a gastronomy tube, or G-tube for short. The other feeding tube goes into the small intestine. It is called a jejunostomy tube, or J-tube for short. In this week's video, I'll focus on the feeding tube, which goes into the stomach. Join me this week as I talk about G-tubes. Gastronomy tubes are feeding tubes placed through the abdominal wall and into the stomach. Gastronomy tubes are used to give formula, liquids, and medicines. They are also used to help vent the stomach of air. The tubes are placed by a surgeon or gastroenterologist. A gastronomy tube is placed in one of three ways. 1. Laparoscopic surgery using small keyhole incisions. 2. Surgically using a larger open incision. And 3. Endoscopically using a scope which passes down the throat and into the stomach to create a stoma from the inside. The endoscopic surgery has become the method of choice at many hospitals. However, some institutes still place the tube surgically. Additionally, people with anatomical abnormalities or who need other procedures may require a surgical placement. Peg tubes and long tubes are one-piece tubes which are held in place either by a retention balloon or by a bumper. They are often used as the initial G-tube for the first 8 to 12 weeks post-surgery. Peg tube specifically describes a long G-tube placed endoscopically and stands for percutaneous endoscopic gastronomy. Please note, sometimes the term peg tube is used to describe all G-tubes. Low-profile tubes, or buttons, do not have a long tube permanently attached on the outside of the stomach. Instead, they have a tube called an extension set, which is attached when the feeding tube needs to be used and then is disconnected when it is not in use. When an extension set is not attached to the low-profile tube, it lies fairly flat against the body. There are two types of buttons. They are balloon and non-balloon buttons. Balloon buttons are held in place by a water-filled balloon. Balloon buttons are the most common G-tube once the stoma is fully healed. This usually takes 2 to 3 months. Balloon buttons can be replaced at home after going through a training session. Some surgeons and gastroenterologists prefer the first G-tube to be a non-balloon button. Non-balloon buttons are harder to pull out than balloon buttons. Non-balloon buttons cannot be replaced at home. They need to be changed out in a doctor's office or at the hospital. Please give feedings and medications as directed by your nurse or doctor. Flush the gastronomy tube with warm water after every feeding or medication. This will prevent the tube from clogging and will keep it as clean as possible. G-tubes are more comfortable than nasal tubes and are a safer option for long-term feeding. Low-profile button G-tubes are not very noticeable under clothing. Balloon buttons and tubes need to be changed every 3 months and can be replaced at home by a trained caregiver. Non-balloon buttons need to be changed every 6 months to a year. They need to be replaced at a doctor's office or at the hospital. G-tubes need to be placed surgically or endoscopically. A common complication for G-tubes is the formation of granulation tissue. This tissue looks like red, overgrown tissue around the tube site. It is not dangerous, but is often very painful and can cause irritation. It may also bleed easily. For more information about granulation tissue, please see the video, Granulation Tissue, Trach Tube, Feeding Tube, and Indwelling Catheter Complication. If a G-tube becomes dislodged, call the GI clinic or surgical office for instruction. If you're not able to speak with a doctor or nurse after 30 minutes, go to the emergency department and take along any and all gastronomy supplies. A tube will be reinserted to prevent the stoma from closing and the need for another surgery. If a replacement tube is not available, a Foley catheter of the same size or smaller can be inserted as a replacement tube. A Foley catheter can be used for feedings and stomach decompression until a replacement tube can be inserted. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Happy Feeding Tube Awareness Week. Bye-bye.